Yeah, so Ian, thanks for joining the Healthcare Growth Cycle podcast.
Thanks for having me.
Yeah, so ladies and gentlemen, this is episode 5 of the Healthcare Growth Cycle podcast. And today we've got an awesome guest featuring Ian Strug. He's the CEO of Corvus.Health, dealing with surgery referral triage and using AI to help surgical practices do that. So it's really a pleasure to have someone on the cutting edge of healthcare and AI from a tool perspective on. And Ian, welcome to the show.
Thanks so much for having me. Really appreciate it and excited to talk more about what we're up to.
Awesome. Yeah. So let's just first start by walking through your career a little bit. Just like give us some background, maybe even starting with academic and then how you ended up getting into founding Corvus.Health.
Yeah. It's definitely been an interesting journey. And I think one thing I've learned in tech is that you encounter folks from every walk of life and every kind of background. Tech, although I think a lot of people think that you need to have a very technical background, you need to be hands-on keyboard coding. What you realize is that in order to harness technology in the right way for everyone, you need a variety of perspectives, and there really is almost a place for everyone to play, and everyone can provide value in different ways. And so I lead off by saying that because academically, my background is in liberal arts. It's English, history, political science, that sort of thing. Just totally non-technical. I went to Vanderbilt for undergrad and had a wonderful experience there. And I think it really just taught me how to think through problems and look at data, look at information, and how to listen to people and tell stories. Those are all the biggest things that I took away from that education. And initially, I was really interested in pursuing an academic career path in English literature and linguistics, that sort of thing, and had some, looking back on it, definitely telling me what I didn't want to hear at the time, but has turned out to be great advice. Basically saying like you should kick the tires and do a couple different things before you make the decision to go the PhD route and pursue like a tenure track level kind of academic career. And a lot of reasons why they encouraged me to do that. One was just the current state of the market in academics is hard to get jobs. There aren't many jobs available. But also they probably saw that maybe I wasn't going to be that successful. There are, other really smart people doing that sort of thing. And I think they definitely want folks to be successful. And so long story short, I decided to not go directly into an academic career and instead go to industry first and, save some money and do what I thought would just be saving some money and preparing for that. Not to bury the lead, 15 years later, I'm still in healthcare technology and have never worked in any other space and really have no desire to work in another space. And so I caught the bug, right? I started my career at Epic. So after Vanderbilt, went up to Epic. That was a function of healthcare technology being a family business. My mom worked at eClinicalWorks and told me to check out healthcare technology, as well as having a lot of folks that I knew from Vanderbilt who landed at Epic.
Okay.
And so went up there, loved the campus, loved how unique and young the company was. Joined Epic in 2010 and was there for a few years, had an awesome experience, really loved it. Feel like it was great to get exposure to such high-end leading health systems, but also really starting to understand how healthcare worked. Uniquely, I was actually on the rev cycle side. So I started my career and for the first 7 or 8 years was in rev cycle, which gives you a unique perspective because it shows you how at the end of the day, for better or worse, in our country, healthcare is still operated as a business. And in order to provide patients with the care they deserve, you need to be really careful in how you run that business and really understanding what makes the wheels turn and what keeps the lights on at a hospital. That's been
Yeah.
super informative for me, especially now that I'm a CEO, but also in my prior startup work in learning how to enter a market and how to create a value proposition that gains resonance with buyers and actually meets their needs. It really drove home the importance of having a clear value proposition and being able to generate real, provable financial ROI
Yeah.
before you can do all the really fun things like patient experience and provider experience.
how would you tie the rev cycle into the value it provides patients? Like, could you give like a specific example where because right now as an analytics consultant, I've kind of primarily been in revenue cycle. And so I know like closest to the value chain, how does a healthcare company make money? But I want to think one step ahead and, we're not quite there with some of our clients yet, but like, how do we benefit patient outcomes with revenue cycle management and proper revenue cycle management? So I just want to touch on that a little bit with you from your
No, that's an
experience.
awesome question because it seems really diffuse, right? And it seems so far away from touching the
Right.
patient. And I'll be honest with you, Christian, when I joined Epic, you don't get to pick what product you work on. They basically look at your profile that they created about you, a dossier about you when you're interviewing. I don't want to spend all of our time talking about the interview process at Epic. It probably looks different now, but back in 2010, it was a mix of, you know, classroom testing and bubble sheets, interviews, presentations, and psychiatry and psychology, Myers-Briggs testing, personality testing. And they're creating this profile of you, and they actually use that to help determine what product team you're on based upon your personality type, which I found really interesting because I was so qualitative in school that I'm on the most quantitative product at
Wow.
Epic in
Right.
Rev Cycle.
Yeah.
And one reason why I was looking at healthcare technology as a place to work was because, on background, I grew up in Boy Scouts and doing a lot of community service and things like that.
Nice.
And I really wanted to have a career that had some tie to human benefit, right? Um, I want to know that the work I'm doing is helping move the dial for humans and patients in this case. And not being a doctor, how can I do that? And so I was like, oh, great. I'm going to help build tools for doctors, and that will be my connection. Wait a minute. I'm building tools for claims processing? Like that was kind of like
Yeah.
how I had to ask myself this question all the time to make sure that I felt good about it. And in reality, it does impact patient care and it impacts patient experience every day. And that's because healthcare providers are not paid for anything they do until they do it. Okay. And so, what does that mean? That means that healthcare systems are always hungry for cash flow. Cash flow is what keeps the doors open. Okay. And so, there's a period of time between when you do something for a patient and you have the cash that comes in the door for that service. And so, in order to optimize cash flows, you need that amount of time to be as short as it possibly can. The shorter the cycle time between care delivery and payment, the more free cash flows you have cycling through your system, the more you're able to do for patients with that cash, right?
Well
And
said.
so
Yeah.
revenue cycle management is incredibly important because one central goal of effective revenue cycle management is to reduce those accounts receivable days. So whatever you can do to reduce those accounts receivable days, better. That allows you to subsidize loss leading departments. And frankly, the problem here is that there could be a department that is a loss leader, a specialty, for example.
Sure.
It's not a loss leader for the patient, it's life saving for the patient. And so that service cannot go away, but we just have to find a way to adequately pay for it. And that can oftentimes happen through optimizing your ability to recoup payment from those who owe you cash for services that have been delivered. I mean, there are obviously other ancillary things like revenue cycle is oftentimes um, inclusive of patient access. And we could wax poetic about patient access forever, but patient access, if you see that as the front door to your organization for every patient, that is your first opportunity to create a good impression, the first opportunity for you to build a relationship with that patient. And healthcare is almost forever and always a relationships based enterprise, right? Um, it's not nearly good enough to just solve a problem like a mechanic would. There's the bedside manner component. There's what is the color of the room? How does the food taste? I mean, all of that impacts the experience. And every health system has an opportunity to optimize that via the revenue cycle and patient access by ensuring that every time a patient integrates and interacts with your system, they have that good experience. So there
That's
are a lot of
great.
ways that it impacts it. It is
Thank
not
you.
just the
Yeah.
back office activity. Yeah, that's a
Super
great
helpful.
question.
Yeah, no, super helpful. It just helps me from a consulting angle too. Like, what else can I do with besides just
Absolutely.
automating baseline revenue cycle
Mhm.
metrics, which we've been doing for a lot of clients?
Right.
how can we take that a step further? So, I mean, this is just,
Yeah,
yeah,
and
it's clarity.
there's one example I'll give you, which is a hybrid between how do you provide a patient with a really good experience, but also optimize for that cash flow is in self-pay patients, right? Or in your ability to kind of look forward past the date of care delivery and see, based upon how that patient is covered by their insurance, what they're likely to owe you after insurance pays. One of the worst things that people talk about in healthcare, and it's happens all the time in the news, right? Is the classic is the L&D, right? I have great insurance, but I got a $10,000 bill from labor and delivery, right? And so people are like, why? There's this mysticism around it, this lack of understanding. People don't know how to read their coordinated benefits, their COBs, right? It's really hard. You get a bill, you get an invoice from a hospital, and you're like, I don't
Gosh.
know where the credits and debits are. It can be really tough, and so those are low hanging fruit from a not only product design perspective, but now that we have so much still nascent but really powerful technology, a lot of things that the revenue cycle has historically done that unfortunately can put a bad taste in a patient's mouth can now be fixed by virtue of artificial intelligence, agentic work. And so, an example of that would be creating best fit patient estimates for every patient. So, that's not saying Christian and Ian, you both need a knee replacement and we're charging you $10,000 for it. It's actually, we have now have an ability to look at people's soft credit scores, seeing their propensity to pay, their ability to pay, their federal poverty level. And based upon the I, unique qualities of every patient, actually give them the most ethical price for them, which is
Wow.
to say, we already know you're not doing well financially. So we're not going to charge you $30,000 because we know we would never get paid that and we would end up selling that bad debt. That would happen 100 out of 100 times. So instead, let's proactively
Wow.
reach out to you and create a payment plan that works for you, makes you feel comfortable about what you're paying, but also ensures that we have the consistent cash flow and are getting awarded for the services that we're rendering and not just left holding the
Yeah.
bag.
Wow.
And that's not only empathetic and says, look, like we're here to work with you on this, but it's also skipping so many steps in this process. You never have to wait for them to just say, I'm never paying this bill. You just you have enough information to know that the likelihood that they respond well to that bill is very low. And
Very,
instead get out in front of it.
yep. That's great. Yeah. No, excellent insight. So just back to your career. So started as an Epic implementation consultant on the revenue cycle side. That's how we got down that rabbit hole.
Yeah,
Moving on from that, though, I've see that you've co-founded or founded a couple of different companies. So I guess just continue maybe walking us through what led up to Corvus eventually.
totally.
Yeah,
So, spending some time at Epic, really looking around and again, mentors were in my ear. And I think having good career mentors is just one thing I'd put a pin in. And just like wherever you have those opportunities to develop mentoring relationships or become a mentor to someone else is not only super rewarding, but like I found it to be one of the most helpful components of my entire career. And there's no chance I would be doing any of the things I've done or enjoy my day to day as much as I do now without having relied on mentors a lot. Now, a mentor
seconded.
of mine was the
Yeah,
CFO at a health system we were
wow,
implementing at, and he was basically just like, you would be a really good consultant. Also, I want to tell you something. Epic is great and Epic owns the market, but the Epic way of doing things is not the only way of doing things in healthcare. And if you want to truly understand healthcare, you have to get out from underneath Epic and see it from from a multitude of different angles and perspectives. And I was like, that actually sounds like it makes a lot of sense. And so I left Epic and went into management consulting. I worked at the advisory board company in DC, and then later at Deloitte Consulting, doing all healthcare work, provider facing. And that did exactly what my mentor Jim Myers at Norton. Love you, you're the best. If you ever have a chance to work with Jim Myers at Norton Healthcare, you're a lucky guy or
there it is.
lady. He's fantastic. Um, I learned so much, and I had again a wonderful mentors at Deloitte. Learned a ton. Really did understand how healthcare is definitely not just Epic, um, and had an opportunity to get my feet wet in entrepreneurship. It wasn't a full dive off the diving board, but in the 20 teens, my boss and my boss's boss from Epic and we all left, or sorry, at Deloitte. We all left Deloitte and joined an Epic staff aug consulting firm. Like they were doing Epic implementation work in Chicago. And the founder of that firm wanted to create an advisory practice that could do rev cycle management, optimization, post install. So he brought us on to really build that out. And so I was still junior in my career, but was really able to learn from these great operators how a business is built and do so in a lighter weight capacity, lacking a tech product, really focusing on services. Loved entrepreneurship, loved having more control over your day to day, but where the business is going. But it was still safe because it was consulting. It was the work I was used to, and that was all well and good.
Yeah.
Super fortunate to be part of a private equity transaction where that consulting firm was sold. And right around that time, a dear friend of mine from undergrad, who's a biomedical engineer by training, working at Intuitive Surgical and the Da Vinci robot at the time. He had this concept for basically video recording and computer vision in minimally invasive surgery and then the endoscopic surgical space. We started working on this concept. He really wanted to start a business around it. And I was just helping him out, kind of moonlighting. He asked me questions as a consultant, right? Like, what do you see at your client sites? What are they using for X, Y, and Z? That sort of thing. And it was an elegant mix of timing as well as the value proposition that Matt was creating was really compelling to me. It just seemed it became clear that the right next step was to do that full time. And so we were able to go through Techstars, actually up in New York City. We did an accelerator.
Very
Our
nice.
company is called Virgo, and Virgo's still doing its thing. We started Virgo, built that company together. I was at Virgo as a co-founder for about 7 years, in a variety of roles, always market facing. I did all the kind of go-to-market work, customer success work, account management, sales, grew that business. And about 7 years in, we had gone through Silicon Valley, banking crisis, COVID, all that. And we were making this pivot to pharma and life sciences, which is a world that I wasn't as familiar with. We pivoted that business, opened a marketplace to life sciences. And 7 years in, I was completely burnt out. And I was not bringing my best self to work. It was not pretty. I was unhappy. It was definitely visible to my team, and that was unacceptable. I really needed to double down on mental health and get that right. And I had outgrown my role at the business, full
Sure.
stop. Where we had grown the business to a point where I was sitting in the chief revenue officer seat. I never wanted to be a chief revenue officer, but the business deserved a really good one. And I wasn't able to bring to the business what it deserved at that time, and I didn't want to. And so it became pretty clear that the best thing to do was to kind of wind my role down, bring in someone who really wanted to bring this business to Series B.
Yeah.
And, as a co-founder, all my equity was vested. And so my interest was not only in getting more healthy myself and having a good life at home, but also making sure that the business was in the best position to succeed financially for all of its stakeholders. And if the best way to do that is to replace yourself, sometimes that has to be the tough conversation. And so I left Virgo, took about a year and a half off where I was doing go-to-market consulting for healthcare AI startups and just seeing
Wow.
those in the market
Yeah.
and working with some peri-op efficiency startups. And then over time, the kind of Corvus idea started bubbling up, and had the opportunity to start working with Redesign Health in New York City, who was thinking about this concept for Corvus. And they had partnered directly with Mayo Clinic to build this company, which when I was able to start working with Redesign on this, learning that Mayo Clinic was involved as not only an investor, but as kind of a co-build partner was quite frankly, like a once in a lifetime opportunity. The opportunity to not just build a product that had immediate resonance in the marketplace, and if we get it right, provides crazily outsized value for the price of the platform and for the ease of install and all these good things about it. But being able to do that not in a vacuum and hoping that it was right for your customers, but doing so with the best hospital in the world at every step of the way, to help develop the IP behind the scenes, as well as just putting things in physicians' hands and seeing how it resonates on a daily basis, um, allows us to really handicap a lot of the risks that you experience when you're going to market. And ensure that when we're ready to open the kimono and go to every hospital in the world, we know the product works and we know the ROI was there, and we can be
Yeah.
incredibly confident about that.
So something I wanted to dive into because I'm just unaware, frankly, is the
Mhm.
surgical referral process and the
Yeah.
problem that
Yeah.
Corvus is solving. Like, could you go into that go-to-market strategy piece about the actual problem with the current state surgical referral practice?
Absolutely. Absolutely. So, at first blush, when I talk about Corvus, and the TLDR on Corvus is that we are a suite of workflows and agentic products that effectively help a hospital best triage all the patients that have been referred to them for surgery. And what triage means is understand, of all your patients who were referred for a particular type of surgery, who is most likely eligible for that case and therefore likely to convert to a surgical patient? Who of those patients are absolutely not eligible for that surgery and should otherwise be receiving different tertiary care treatment plans? And then navigating those patients to the right place. The ROI and downstream value of that is you increase your OR utilization because you ensure that you're providing consult visits and triaging into the ORs all those patients that based upon the work that we do at Corvus, they are a good surgical candidate. But at the same time, for all those patients, getting back to our relationship building and the importance of really being a good navigator for all your patients, providing them with that good first impression,
Yep.
is instead of just receiving a referral for a patient that's not a surgical candidate and frankly leaving them at the bus stop and saying, it doesn't look like you're a good candidate for this case. See you later. You should go get some physical therapy. Instead, hand holding them into that conservative treatment, saying, hey, we got this referral for surgery. It looks like you've been going through it with your back. That's terrible. We actually have good news. You don't need surgery. We don't want to give you surgery. What you need is infusion pain management and physical therapy. And we have an institute for that. We have an opening on Friday. We have all day on Friday open. Can we get you in to learn more about what your options are? We'd love for you to meet with a neurologist and talk about pain management. That's a far better experience. But it
Yeah.
also allows you to bring that patient in, get that stickiness. So now they are ingratiating themselves with your system, and that drives incremental revenue to the practice, right? So you're still making revenue from that patient visit and the subsequent treatment plan. But also, if they end up needing surgery, you already have the relationship with them. And they already have that kind of preliminary work done at your site of care, such that it makes that decision making process far easier. Why is this a problem today? Well, the problem today is that referrals happen all the time. It is no work for a PCP or another specialist to refer you to a surgeon if they think you might need surgery. And it could just be
Wow.
anecdotal. I just think maybe it's worth it. Maybe you should talk to a surgeon. That could yield a referral. Or it could be, you need surgery yesterday. I am referring you to a surgeon. They're going to call you today because you need to get an appendectomy now. Or that's emergent, so it's not quite as
Sure.
relevant, but you know what I mean, right? So it could be there's this broad spectrum of, it might be valuable for you to talk to a surgeon, all the way to you have to talk to a surgeon. The referral looks the same, but the level of quality is very different. And so it creates all of this office and review and clinical review work. But today, current state, only 30 to 40% of those referrals actually convert to a surgery.
Wow.
Okay. At the
Yeah.
same time, the OR is typically about 65% of the contribution margin for the hospital. So the OR is the financial nerve center for the hospital. It keeps the lights on in every department. Okay. So if you have a department that's a loss leader financially, it's subsidized by the OR.
Okay.
You can't get rid of that department because it's not a loss leader to the patients who go there. It's life saving for them. Right. So you have to find a way to keep the lights on. It's the OR that is subsidizing these departments. And so anything you can do to increase OR utilization is going to impact your bottom line positively. It's going to impact your top line very positively, but it's going to ensure that you're able to preserve your margins. And in a world where, in a good economy, it would allow you to grow your margins. Looking at macroeconomic events that we're likely to experience with things like Obamacare subsidies going away, those are the questions that buyers are asking themselves, right? They're doing forecasting and saying, okay, by virtue of Obamacare subsidies going away, our revenue is going to go down. If our revenue goes down, how can we continue to afford paying for pediatric rheumatology, which doesn't do procedures? Well, in a world of reduced margins and reduced cash flows, you keep that department open by increasing your OR utilization and ensuring that you're driving more revenue through the OR. That's going to be how you patch that hole effectively. And so our financial value is readily apparent. It is implement Corvus, do more surgery. Implement Corvus, surgeons, they go to their clinic day to do consults. They can now be confident that every patient they see in consult is adequately prepared. They have the imaging they need to be a relevant candidate. They have the labs they need. They've done the required conservative treatment that their payer needs to see to get prior auth. So every patient that you go into consult visit room, 12 months of physical therapy, labs, infusions, done. Okay, great. And the likelihood that they convert to surgery is far higher. We want to see a world where you never have a surgeon go into a consult visit and say, tell me about the MRI that you had within the last 30 days, because that's a requirement for surgery. And they say, I've never had an MRI. Because that's an hour that no one can get back. So visit that doesn't get paid for. It's an hour that could have been spent in the OR. The patient's now sitting there like, what the heck did I come here for? And those practices are so busy that what will probably happen is they just say, oh, well, to be a surgical candidate and for us to have a valuable experience together, you need to get a full CT scan or MRI of your knee. And so you need to go do that. Once you've gone and done that, we can reschedule you.
Okay.
And that might be it. And that patient might not even get that imaging done at the same site. And so
Right.
you've already kind of started adding friction to that relationship. That patient's driving home like, should I just go somewhere else? This is ridiculous. Like,
wow.
Maybe that surgeon will operate on me or otherwise, right? They start shopping around.
Okay. Yeah.
So that's what we do at Corvus, and that's kind of how the value cascades from our receiving a referral all the way to bottom line impact.
Wow. Yeah. No, that's amazing. It's just because I was thinking about it before the podcast, and there's so many subspecialties. I'm like, why would a patient get referred if they're going to get like, hey, you don't need surgery? But so it's just amazing to me that so many practitioners, and I'm not speaking ill, but like, it's just like, would just blindly, oh yeah, well maybe. And then it wastes the surgeons and the surgical practice's time.
Absolutely. I mean, there comes what I've been learning a lot about here, and a lot of what we're doing is based on this front door concept, right? I've mentioned it a few times of access being this front door and how the front door can be your first opportunity to build a relationship. And that is really critical. Relationships are critical in healthcare because of stickiness and the ability for folks to go to a variety of different locations for their healthcare. I mean, just in Wisconsin, right? I mean, not even using Chicago as an example, where I can literally like throw a tennis ball in any direction and hit an immediate care practice from Rush, UChicago, Northwestern, Advocate, Ascension. I mean, I have so many options. But even like, where you are in Kohler, La Crosse area, or sorry, not La Crosse, but Appleton, I can think of like 5 or 6 different options for you, right? I mean, there's University of Wisconsin, Freighter, ProHealth. I mean, there's so many. So you have to build those relationships. And so to your point about specialties and quality of referrals, what we've seen a lot of in the market is care coordination and patient navigation, right? Tools that are really meant to help a patient navigate their care journey. And to use your term, not to speak ill of anyone, because I truly believe that most folks, especially working on the technology side of healthcare, really do want to make a positive impact and do things the right way. And it takes a lot of iteration to find out the right way of doing things. A lot of those products that seek to do care coordination have ended up being pretty simplistic patient provider matching tools saying,
Okay.
I want to meet with a surgeon. I have back pain. I want to talk to a neurospine surgeon. Okay, great. ZocDoc is going to find the next available neurospine in your zip code and book you with them. Now, that might be a very poor use of everyone's time based upon your actual clinical needs and your natural disease history. To your question or comment about the quality of referral, it's actually kind of actually kind of similar. Imagine you're a 72-year-old otherwise very healthy person living in Jacksonville, Florida. You retired to Jacksonville, Florida, and you have a lot of knee pain or back pain. You've
Hmm.
been complaining about it for years. You've tried a few things, but you haven't really gone to physical therapy as often as you should, and you decided to not call the pain management specialist about a steroid infusion, so that never happened. But you're back in your PCP's office and you're complaining about your back, and your doctor is just sick and tired of hearing you complain about how much it hurts to play pickleball.
I see.
And
Yeah.
so they just say, like, go to Mayo and talk to the surgeon about it. The
Right.
surgeon's going to see that you haven't had infusion therapy and then you haven't done 13 months physical therapy, and they're going to tell you to do those things. That's what's going to happen.
Yeah.
Um, and so our strategy here is to really upend the provider matching strategy. And we're actually saying, no, we don't think the customer's always right. But what the customer thinks they need and what they want are very different things. The customer being the patient. And what the patient might want is actually not what's best for them, which is why we're taking this clinically deep build approach to actually build these intake and review protocols on a subspecialty specific basis. So our go-to-market strategy is not one where we can go to every hospital in the country and say, plunk every surgical referral that you have through our system today, and it will tell you how eligible that patient is. We're taking this specialty first approach. And so we're actually going to market saying, we can do this for neurospine, we can do this for cardiothoracics, we can do this for a subset of orthopedics, full knee and full hip, we can do it for bariatric surgery, and we can do it for pancreatobiliary and surgical oncology in those areas.
Okay.
We get those super right, and we continue iterating our data model into additional verticals over time,
Okay.
right?
Yeah.
And that's really how we enter the market. Because what we found is, in order to get these patients the best possible experience and the best care, you have to take that clinically deep clinic approach first. That has to happen first. And we now have the ability to do that before they ever talk to a surgeon and make the
Sure.
surgeon's life easier from a review perspective by virtue of, agents and good UX and things
Yeah.
like that.
I don't know how much you can speak on the actual AI model, and all the features that you're pulling, I'd assume, from the electronic health record. Are you integrating with multiple different EHRs? Is it, I guess, walk us through like the process of actually being able to build these for these subspecialties and ensuring that they are accurate by patient. I
Yeah.
just, because in my experience with EHR, sometimes there's incomplete data, right? So I'm just curious as to how you guys work through any kind of data incompleteness for a particular patient.
Yeah, no, that's a good question. The first thing I'll say is data incompleteness and the inability to see a fulsome, complete longitudinal medical record for a patient
Right.
across all sites of service, inclusive of the sites that are not where the referral went, right? Like, if you're referred to a surgical practice you've never seen before, but that surgeon can't get their hands on every part of your medical record
Yep.
from wherever else you've
Beginning
been,
of time. Yeah.
you have to start with a symptoms review from the ground up, and we're right back to square one, right? So that can be really terrible. I mentioned that because I only think that I truly only believe that it's possible to build a company like Corvus now. Like, now is the magic moment, and that's
Sure.
a blend of amazing technologies that we can license and bring into our platform via APIs and integrations, build versus buy type questions that have come online, as well as that paired with regulatory capture. So TEFCA and the ability through the ACA to legally go to health exchanges and bring back medical records from third-party sites to help complete that medical record. The eligible use cases for doing that have continued to increase, where now it's possible for us to do that when you receive a surgical referral. That's so one way that we obtain a full view of what the patient's done is by accessing health information exchanges. And we do that through a partnership with Zeus.Health. That's our partner of choice there.
Amazing.
And so far, they've been incredible. Only good things to say about Zeus. Their coverage is amazing. It's an amazing product, but people make the place, and their people are incredible. So, for example, when we see a patient's medical record, we're able to, our end users at the click of a button can go and bring back all of the medical records that exist at the variety of national health and county level exchanges. We then on our end normalize that in the UX such that everything is presented to the end user in a very easily and easy to digest way.
Yeah.
Getting back to training data and kind of AI, right?
Sure.
There are two kind of we all hate the word silo, but there are kind of like two not necessarily mutually exclusive, but in some capacities, mutually exclusive ways in which we're using AI at Corvus. One is for true clinical specificity and clinical review, right? That's saying, okay, patient comes in the door, they're looking for spinal fusion, and let's actually use artificial intelligence plus Boolean logic, right? If then statements, logic trees, decision trees, to actually understand how likely eligible that patient is for that particular type of surgery. So they would go through a model that's been built specifically for neurospine, right? So that's one way we're using AI. Review, machine learning, things like that. The other is more on the generative and agentic side, right? So that's using pre-existing LLMs and tools like Gemini to go out and call out to a payer for a prior auth, or automatically generate in Epic, going back to that example of you actually don't need an operation, what you need is physical therapy. When that happens, pre-generating an order for a physical therapy visit. So the surgeon doesn't actually have to create it on her own. They just review it and sign it.
Yeah.
Or for prior auth, writing the letter that goes to Aetna, and the provider then has to read the letter and say like, yep, this is cool. And they sign it and send it. Right now, surgeons spend a lot of time like literally writing emails and letters. This is why you should cover my patient's surgery. We can do that. Like we can absolutely handle that. And so those are kind of two different ways. And they're trained using different pieces of information. A lot of the latter is very well accounted for by pre-existing tools available in the market like Gemini.
Yeah.
And the way that we impact that is via RAG, right? And so that's creating our own database of proprietary and subject matter specific information that we are then able to add to a pre-existing LLM in a closed, walled garden.
Wall garden
capacity.
in tenant. Yeah.
Right. As it relates to
Great
the
breakdown.
very kind of specific clinical breakdown of things, quite frankly, that's where our relationship with Mayo Clinic provides such outsized value, because not only are we able to work directly with Mayo Clinic to utilize and better understand data assets and what's available.
Yeah.
From a financial side, as a startup, we don't have to turn around and make $1 million data purchase to a broker. So when we raise money, I don't have to go and write a 7-figure check just to a service provider so we can have adequate training data. We're able to get that by virtue of our relationship with Mayo Clinic.
Yeah.
And that, because of the existence of things like Mayo Clinic platform, we're able to directly address your question around like data sanitization and cleanliness and completeness.
Yeah.
Is we look at that in two ways. Obviously, we need platonic data to just create that platonic use case, the best possible gold standard. And so looking at really, really complete, beautiful, well-manicured registry data that Mayo Clinic produces is really helpful there.
Yeah.
But as you can imagine, that's not the way the real world works. And so what's actually really exciting to me is building our models and testing them against the way the world really works. And it's actually really important to have more data that's true to production and true to life, because that's what you're going to experience. And so working with other
hospitals
teams, exactly. So working between both the data teams at Mayo Clinic that give you amazing, beautiful data curated, as well as for example, the Epic team, and they have particular teams that are just there to pull data. directly out of the back end of Epic that might have holes, might not, but it's exactly what got in there. Because that's what our end users are going to see and deal with. That's what our models have to be able to handle. The last thing I'll say on that is one of our first products, one feature as part of our MVP that we're rolling out in Q1 is what we're kind of calling our dynamic intake and dynamic assessments. And what that is effectively it's what we use to do the final spackle on the wall, right? Like there's one more nail hole that, we don't know, right? We brought back all the medical records, but we still have questions. Typically, those questions are going to be pursuant directly to the indication that we're concerned with. So it's going to be like, okay, you want back surgery? Like, where do you have pain, right? How bad is that pain? And so for every patient that comes through the door looking for a referral, we create an assessment form that goes to them digitally, whether that is natively through Corvus or more commonplace through MyChart in Epic. It would be something that
Okay.
they actually receive through Epic. Dynamic assessment form. They bring it up and it only asks them questions that are relevant to that referral that they have never been asked before. So you don't have to go and open up the family history and tell them that your grandfather had IBS in 1945 because you've already told them that a million times, right? That's been on a clipboard 30 times in the last 10 years for you. You don't have to answer those questions again.
Sure.
We're only asking you certain questions, which leads to a decision tree where if they answer this, they get another question and pinball through that.
Yeah.
Dynamically. And so that really helps us give the clinician and the surgeon as much information as possible going into that visit. So that symptoms review is super, super valuable. So in the example of spinal fusion, it would be something like, like a Vitruvian Man diagram, and it says, where does it hurt? And you say bicep, you click bicep, and then it might present to you, is the pain circulating or radiopathic? And a little tooltip, what do these mean? What's radiopathic? It'll give you a definition. You say, okay, radiopathic. Okay. Or it's like, does that lead to numbness in your index finger? Yes. That, all of these things called dermatomes, they map back directly to where you would actually get your spinal fusion. Radiopathic pain in their
Yeah.
index finger, C3-4 fusion right off the bat, right? And so that just preloads a ton of information for the surgeon,
Yeah.
but also helps us with that data completeness problem.
Fantastic. Oh, that was an amazing response. And I also appreciated that you delineate between like proprietary ML models versus where do you just use third-party agents or LLMs like Gemini.
Yeah.
What are the use cases between the two? I that just really helps because I feel like so many people always say they use AI. It's like, well, what kind of AI are you really talking about? And I love that
Right.
you just
And
got
I
right
think,
specific.
especially nowadays when, let's be honest, almost if not every company is going to be using or is trying to use AI in some capacity, whether that's
Right.
internal or in their products. And so to say that every company is an AI company is becoming more and more true. So it's not exciting to say you're an AI company, right? Like when I say AI powered referrals management, that means nothing to me. What matters to me is if it works or not. And quite frankly, if it didn't even need AI and it worked, that's good enough. That's awesome. We could not do what we do today without what AI is capable of. And that's pretty well understood.
Yeah.
But the AI for the sake of AI, that's not sexy. What's sexy is providing value to your end users. And if AI unlocks your ability to do that, incredible.
Amazing. Yep.
But in a world where everyone's using AI, what becomes super important for your customers is to understand the provenance. That's your statement. That
Right.
is, we want to know how it's being used, where it's being used, why it's being used that way. And if you are using proprietary AI, where did you get the data? How much of it? Who gave it to you? Was it, is it credentialed?
Was
Is
it
it
complete?
validated?
Yeah.
Right.
Yeah. Yeah.
Really understanding that provenance issue becomes far more important than just are you using AI or not? Because the answer is yes, or everyone's
Yeah.
going to try to say yes.
Yep. Yep. for the marketing brochure too.
Absolutely right.
Yeah.
Absolutely right.
Yep.
It's got to work. And
S-
quite frankly, like the tooling available in the open market today is just so incredible.
Yeah.
And it continues to get better.
I
So,
use Claude every day. I'm a Claude
yeah,
guy, like
it's
every day
incredible.
for a ton of things. Yeah,
Yep.
yeah.
It's awesome.
Um, so just transitioning a little bit, I know we're at like 45, so we're going a little bit over, and that's fine because I usually try to target 30, but that's totally fine. On the leadership business front, running Corvus and then some of the other companies that you were either like C-suite or executive level. What are some aspects that make a healthcare company successful in the market from leading it like a leadership perspective? Let's just get into that a little bit, some soft skill
Yeah.
things.
Yeah. So that's a really good question. Okay. I'm going to start with two things. One is capital, which I do consider a leadership thing because it's your job as a founder to ensure that your company has the gas in the tank to continue driving down the road, right?
Sure.
So
Yep.
you have to be default. It's your job to keep the company default alive, and whether that capital is coming from customers or capital markets or otherwise, it doesn't really matter to me right now. Um, but it's your job to figure that out. Okay. The second thing would be quite frankly, it's I mean, team building at the end of the day. And so to get into the first, there's a like George Washington. I'll use George Washington. He's a pretty good leader, right? I think we can all agree George Washington's a good leader. He was very, very unsure and resistant about taking the job of commander in chief of the colonial military, right? Like he was kind of like, I don't think I'm going to do this. Like, I know you guys want me to do this. I don't think I'm down to ride. The reason why was because he was unsure about resources. And I can't remember the quote verbatim, but it's something to the effect of um, a good leader does not take the responsibility for something that they don't believe is well capitalized enough to succeed. So don't try to lead something that doesn't have the required material and support to actually get it done. If you're going to be like, because you're only, um, like it's only not your fault if it goes well,
Right. Right.
And so it's like
Yeah.
for every reason that the business fails, it's your fault. Full stop. So don't get involved with this if you don't believe that it has the requirements to be successful, right? 'Cause I can't do this on my own. And I need capital to do it. If I only had 500K of seed capital, I don't think I could build this business successfully or the way I wanted to at least. So if those were the terms by which Corvus was founded, not for me. Like I need to know that this is a leadership role that I can effectively lead because it has the building blocks of success. And one of those things in the startup world, especially in healthcare, because you have a long pathway to market, you have long sales cycles, you need to
Yeah.
have enough capital on the balance sheet to subsidize the length of those sales cycles and the length of product iteration because you can't get clinical things wrong. And then down the road, same story. If you need to go through a regulatory pathway for 510K or de novo, you surely need to have enough gas in the tank to get through all of the work required to gain those approvals. So one thing on leadership side is understanding what your business needs to be successful, rooting to that, and getting that done. Whether that's capital or the next thing being team management.
Yeah.
I am very, very serious about being the dumbest person on the team. Like, I don't ever want to be a better product designer than our chief of product. I don't ever want to be a better accountant than my head of accounting, right? I don't want to be a better integrations developer than our solutions architects. Um, Surround yourself with people that will teach you something every day. Surround yourself with people that are always going to do a better, deeper job at what they're tasked to do than you would be if you were in that seat, which is a long way of saying, like, get A players wherever you possibly can, because A players breed A players. B players make A players want to quit their job, and C players make a C company. So you need to start with high end talent and continuing to allow them to grow in their roles. And so
Yeah.
another way of looking at that on the flip side is, well, what's my job? Am I just like that guy that does podcasts with Christian? Well, part of it is that, like, you have to get the name out and you have to be the face of the business and lead from the front in that regard. But leading from the front is also doing a lot of the really labyrinthine, sometimes boring, pulling out your hair, blocking and tackling. So a lot of what my job is, it's getting my teammates what they need as fast as I can in the best possible way. Whether that's in our world, breaking down doors at Mayo Clinic and getting our folks in touch with
Right.
neurosurgeons there so they can talk to them, and finding who that person is and just having a million phone calls to get there. Or if it's, going to the mat on a vendor deal and just making sure we get the right discount. It
Sure.
could be so
Yep.
many different things, but it's really the blocking and tackling of lubricating the business operation so people can show up to work every day and focus on what they're there to do and what they're passionate about doing,
Yeah.
and not all the side BS, frankly.
Found. Yeah. And enduring the long sales cycles in healthcare, like you mentioned
Yeah.
before. I know I'm
Yeah.
pretty
And like
accustomed to
the more
that
I
right now.
find, a lot of it is like checking yourself and like being a consistent voice. So much of it is just showing up every day and like showing up on time. If you say you're gonna be in the office for a 9 o'clock meeting, like be there on time for the 9 o'clock meeting. Don't take your leadership role as latitude to do whatever you want. It actually means that you have far less latitude. Like I think if you're looking
Follow
at leadership
through.
the right way, you actually need to be the most hardcore rule follower. It doesn't actually just, oh, I'm the CEO, I can do whatever I want. It's actually the opposite. It's like, I need to do everything right now. And that can be really hard. It's not easy. And
Yeah.
like, there are so many times where I'm like, I really just want to sleep in today, but like, you know, I have a co-founder who wants this to be an office day, and like, I got to get there on time.
Get up and yeah.
I
Yep.
will also give a shout out to my co-founder, Jacoby. I've never beaten him to the office. I'm
Wow.
still trying. I haven't done it. Like, this guy has me dead to rights. Like, I don't know what time he gets up in the morning, but
Boom, boom,
he's
boom.
good. He's good at
Yeah.
what he does.
Awesome. Well, I think that's a lot of great content on both the technical implementation front all the way through to leadership. So, Ian, it's been an absolute pleasure, and I just like to give you the floor. Where can listeners follow you,
Sure.
follow Corvus, and then where can health systems connect with you too if they're listening to this?
Yeah, absolutely. Like I briefly mentioned earlier, we are really heads down building with Mayo right now. We have our first go live scheduled for Q1. Shortly thereafter, we're planning on going to market more broadly. You'll be able to find us at the big major trade shows down the road, like Vive and Health and HIMSS and all that good stuff. But in the meantime, please follow us on LinkedIn at Corvus.Health, Corvus. Available there. Also, I'm on LinkedIn at Ian Strug. My email is ian@corvus.health, and our website is corvus.health. You might need to do https://corvus.health. You can find us directly through the website or through LinkedIn. We'd love to hear from you. Please follow our journey, and we're really excited to start positively impacting more and more health systems in 2026.
Incredible. All right. Well, ladies and gentlemen, that's episode 5 of the Healthcare Growth Cycle podcast. We will see you on the next episode. Thank you.
Thank you so much, Christian. Have a good one.